Hello everyone, my name is Yasmine Castañeda and today I will be talking about the World Health Organization and their stance on the importance of child immunizations in Italy. Today I will be going over organization background, country overview, issue analysis, and stakeholder analysis. The World Health Organization is a specialized agency of the United Nations responsible for communicable diseases such as influenza and HIV, and non-communicable diseases like cancer and heart disease. Five key values of the WHO are to trust and serve public health at all times. They have professionals who are committed to excellence in health, persons of integrity, collaborative colleagues and partners, and overall people caring about people. Some historical events and key dates. In 1948, on April 7th, the WHO was established by Constitution. That day is now known as World Health Day. Other historical events include 1958, where a smallpox vaccine promotion program was developed, as well as in 2005, the WHO published its international regulations paper on guidelines. In most recent news, on March 12th, the WHO announced an international state of emergency for COVID-19. They labeled this a global pandemic. Structure. The WHO is headquartered in Switzerland. They have close partnerships with UN agencies, donors, foundations, academia, and different organizations within the public sector, private sector. The WHO staff are committed to establish and facilitate better health for everyone. In today's world, the WHO is more than 7,000 people working in 150 country offices and 6 regional offices, including Europe, where we will talk about Italy. Here we have the organization chart of the WHO as of March 6, 2019. Stakeholders. The WHO is seen as an essential leader to improve global health outcomes. The WHO is perceived as the most effective organization at influencing policy for improving people's health at the global level. A majority of stakeholders commend WHO's leadership of the Ebola outbreak, but confidence in the WHO's ability to manage future public health threats, such as COVID-19, has been challenged. Some external stakeholders' perceptions vary depending upon geographical locations. Some stakeholders include doctors, employees, media, and policymakers. Per Rollins 2006, defines stakeholders as any group or individual who's affected or can affect the achievement of an organization's objectives. Italy. Italy's background. Some fun facts. Vatican City in Rome is the smallest country in the world and is led by the Pope himself. The colors of the Italian flag are green, white, and red and have special meaning. Green represents hope, white represents faith, and red signals charity. Italy boasts the 8th largest economy in the world. Italy is a country in South Central Europe near the Mediterranean Sea and is part of the European Union and the Council of Europe. The capital of Italy is Rome, one of the oldest of the world's cities, standing at 3,000 years old. The city is full of historical monuments and art spread out throughout the city. Italy is known for flourishing during the Renaissance era and housing the Pope. Infrastructure of Italy. Italy has a republic. They have 3 branches of power. Like the USA, they have the executive, legislative, and judicial branch. The president is the head of the state, and he has a large role. A fun fact, Italy's presidents are elected by secret ballots by parliament and regional representatives. The politics of Italy are conducted through a republic with a multi-party system. They also have a constitution that was promulgated on January 1st, 1948. Executive power is exercised by the Council of Ministers, which is led by the Prime Minister. And general elections in Italy are held every 5 years. Key takeaways for culture. As you can see from this chart, Italy and the United States are ranked in power distance, uncertainty avoidance, long-term orientation, and indulgence. At a score of 50, power distance, Northern Italy tends to prefer equality and a decentralization of power and decision-making. For uncertainty avoidance, Italy has a high score, which means that it's a nation that is not comfortable in ambiguous situations. At 61, long-term orientation for Italy is pragmatic. Their indulgence score is 30, meaning societies with a low score in the dimension have a tendency for pessimism. Media and strategic communication in Italy. Italy has one of Europe's lowest press freedom rankings. Freedom of the press was first established in Italy after its unification in 1861. The mafia is one of Italy's biggest threats to free media. In Italy, journalists choose to censor themselves because of the pressure put on them by politicians. Concern. Italy often blends politics and the media, which has led to concerns of media ownership. Italy's three main channels of communication is television, newspapers, and radio. The World Health Organization in Italy. As you can see here, I've included a chart of the regional office in Europe. This gives a rundown of the different executive management roles and their teams. Italy is one of the several countries in the European region of the World Health Organization where outbreaks of vaccine-preventable diseases have occurred in recent years. Since July 2016, there have been 35 measles deaths in the region. Issue identification. Our issue here is communicating the importance of childhood immunizations toward vaccine-preventable diseases in Italy. The issue. Italy bans unvaccinated children from school. This rule has been set into place by a new law called the Lurzin Law, adopted in July 2017, named after a former health minister who claimed children required a range of vaccinations before attending school, per the BBC. This law states that children up to the age of 6 will be excluded from daycare and kindergarten if proper proof of vaccinations is not present. The law was passed to raise Italy's far below standard vaccination rates amongst children below 80%. With the help of the World Health Organization, the rates were able to rise to the 95% target. Issue management. Per Douglas 2008, issues are commonly described as having a life cycle comprising 5 stages: early, emergent, current, crisis, and dormant. Given the importance of vaccines and lack thereof seen in the most recent global pandemic of COVID-19, many families and institutions are understanding the importance of vaccine-preventable diseases. The issue at hand would be considered a current issue in Italy, as children are always needing vaccines as they age and following the World Health Organization's recommended childhood immunization schedule. Vaccines and Italian children. Per the Lurzin Law, they are required to get 10 different vaccinations before entering any type of school. That would be against polio and other vaccines. The Italian government has enforced the vaccination law and works closely with the World Health Organization to hit a target coverage of 95%. Opposition. Anti-vaxxers. The belief that vaccines cause autism has aided a widespread attitude towards vaccines. In most recent years, a statement has since been debunked by the U.S. Centers for Disease Control. Anti-vaxxers are one of the biggest threats to global health towards vaccine-preventable diseases. The World Health Organization strives to promote the benefits of vaccines by sending messages to the public about the safety and efficacy of vaccines. The importance of child immunizations. Here you will see a child immunization schedule brought to you by the Italian region of the WHO. Dittman of the World Health Organization's regional office in Europe has developed an expanded program on immunization. This program has globally prevented at least 3 to 5 million child deaths per year. The more widespread and available vaccines are, they could prevent up to 1.6 million deaths a year among children under the age of 5. The World Health Organization. Why is this important? The WHO says 93 to 95% of population must be vaccinated to produce herd immunity against diseases such as measles. Italy's pediatric measles vaccination rate has traditionally lagged far behind that goal, hovering around 85% for the first dose and 83% for the second dose as of 2015. According to the WHO data, by 2017, the year the mandatory vaccine law took effect, that number was up to 92% for the first dose and 86% for the second, meaning that law definitely helped raise numbers. Stakeholder analysis. The enabling linkage includes executive board, policymakers, government regulators. The normative linkage includes health institutions, political groups, professional groups. For input, functional linkages include vaccine suppliers and employees of various organizations such as the WHO and any of the pharmaceutical companies producing the vaccines. For output, functional linkages include vaccine consumers, in this case, the children that are receiving the vaccinations. For diffused linkage, we have Italian communities and the media of television, radio, and newspapers. Stakeholder analysis. Per Rollins' 2006 article and the linkage model, expectant stakeholders possess two attributes and are organized into dominant, dependent, and dangerous stakeholders who have power, legitimacy, and urgency. With that in mind, the WHO has a few stakeholders, including decision makers, who are government agencies and other government departments at the national level. Influencers, who are in health partnerships, foundations, intergovernmental and non-governmental organizations, civil society, media, professional associations, and WHO collaborating centers. Lastly, the people of the world. For stakeholder assessment, first and foremost, the WHO needs to strategize with governing bodies in Italy in an effort to advocate the importance of childhood immunization schedules that must be pushed and implemented by physicians and enforced by local governments. The next group of stakeholders to address would be the influence of the media that possesses legitimacy and urgency on others. These groups have the power to influence and persuade parents to choose protection for their children and ensure their place at school. Lastly, a group to prioritize would be simply the people of the world, by giving proper communications and messaging to advocate the benefits of vaccinating against preventable diseases. Here are a list of my references and questions. I am looking forward to answering questions in this week's module. Thank you for viewing my presentation, and I look forward to viewing yours. Thank you.